The broadcast is now starting. All attendees are in listen-only mode.
Hello, this is Jocelyn Martin, Senior Living Consultant with Holleran. Thank you very much for joining us for our third webinar, Tracking Social Accountability Initiatives. Since Holleran started its work with social accountability and the study that we performed last winter, we have received numerous questions about social accountability. Some of the topics we have already reviewed, and we are planning future webinars to review the other topics that we get several questions on. By far, though, Holleran receives the most questions on tracking social accountability, from everything from how people develop their system, how many hours they spend, how often they track their initiatives, how often these initiatives are reported back to someone, how people determine financial valuations, as well as what activities they track. What do they count for social accountability? Well, for this call, we have 3 different experts within the field to discuss what they've done within their organizations. For our first speaker today is Trina Hackensmith. She is a lead software trainer from Lion Software. She's going to discuss with you the importance of tracking, why we need to track this data, and then how to collect the initiatives. She's also going to review telling your story and why that is so important when it comes to social accountability. We also have David Grant, Senior Vice President and General Counsel from American Baptist Homes of the West, on the call to talk about how his multi-site organization tackles tracking social accountability as well as financial valuation. He also will be providing additional resources for you as far as what they use at ABHOW, and they will be provided to you following the webinar. We also have Kathy Palacita on the line today. She is the Director of Charitable Giving and Community Outreach for Fraser Meadows Retirement Community. This is a single-site community, and Kathy is going to discuss, once again, how they, as a single site, collect this data, what activities they count, and how they perform their duties as a single-site organization. At the end of this webinar, you will have a chance to ask questions of the speakers. I will review this once we get to the end of the webinar. However, in your lower right-hand box, you should see something that says questions. You can type in a question there, and I will ask the panelists to answer their question. In addition, the resources from today, most of you should have received the PowerPoint that we're about to review today. However, we also will be sharing with you the audio recording of this webinar. It will be available through Holleran's website under our library. It will be available on Leading Age's website underneath their Social Accountability Toolkit, and all materials will be emailed to the attendees within a week. So without further ado, I am going to hand the mic over, if you will, to Trina Hackensmith from Lion Software. Trina?
Okay.
Let's
see if I have it. Okay, I think I have it. No, I don't have it yet. I think you still have it. Jocelyn?
Go ahead, Trina.
Okay, have you turned it over?
Yes.
Okay, great. Thank you. Now I have it. Well, good afternoon. My name is Trina Hackensmith. I've worked for Lion Software for almost 6 years now as the lead software trainer, and during that time I've been involved in developing the software to really help you to capture your social accountability, and then also training the senior living providers about social accountability or community benefit, what it is and how to count it, and then of course the importance of collecting, reporting, and tracking this information. But the first question we want to ask is really, why do we track social accountability information? What makes it so important? We want to be able to show that we've met that tax-exempt mandate, but also that we're committed to the community that we serve by meeting their needs. Throughout my presentation, when I use the word community, I'm referring to those really who are outside of your residential communities. Our communities may be asking questions like, is tax exemption of not-for-profit aging services providers appropriate? Is there a difference between not-for-profit and for-profit providers? Are not-for-profit providers only serving the affluent? Or how about how can we make sure that not-for-profit organizations fulfill their missions beyond that residential care? We really do need to be able to answer those kinds of questions. And social accountability is one way to show that we are meeting that not-for-profit standard and requirement. When we're looking at the amount of social accountability information, we realize that there could be a very large volume of data that should be collected. Things like how much, when, where, who, and even why. You really need a system in place to easily handle what could be hundreds of different programs that you're doing, plus those numerical statistics, and then even the stories of social accountability. There may also be many different types of information to keep track of, like those program descriptions, or how about your objectives? Why are you doing what you're doing? Your target audience, whose needs are you reaching to meet? What are your goals? What are the costs involved? And then those offsetting revenues. The information that you are collecting needs to be verifiable. Where did those numbers come from? How did you decide what programs should count as social accountability or community benefit? And what happens if you're audited, either internally or externally? Can you verify more than just maybe your charity care or Medicaid dollars? There may be hundreds of different programs or services that you're doing that can and really should be captured and recorded above and beyond that charity care or Medicaid. If the information that you're collecting is collected in a systematic and structured way and routinely collected by your staff, then you're going to really be able to provide an accurate picture of your organization. Each time your staff collects the social accountability data, it becomes easier, less time-consuming, and oftentimes more complete. Maybe what was once an idea about capturing the social accountability information really does become reality. Social accountability tracking and reporting becomes a priority when it's given its proper importance. Now, you may be dealing with limited resources, either dollars or staff, so it's really important to plan and manage those social accountability programs. And I believe that education for your staff is key. The more the staff members understand about social accountability programs, then the more input you at the management level may receive. That educated staff is going to help you to be able to discover those programs that you're doing that really do qualify now as social accountability, or they may even be able to offer ideas about how to tweak other current programs that you're doing to include those community members and change the focus from just the residents to the broader community. Having your staff understand that they're part of something bigger than just collecting statistics or inputting data so it can be reported on may generate a new awareness of community benefit or social accountability programs, and may even generate a new excitement or awareness about making a difference in your community. Remember that your social accountability reports are going to help you to show your community and the government that you're fulfilling the requirements of your tax-exempt status. You're worthy of that tax exemption because you're providing not only housing and health care for your residents, but you are reaching out to your community, providing much-needed services, oftentimes to the most vulnerable, the elderly, the frail, maybe even the disabled within your community. Budgeting for social accountability programs may be difficult, so having a historical point of reference is always going to help. Can you look at last year's information to plan for next year's programs? Or if you're just getting started, how about can you look at last quarter's information to plan for your next quarter? Without an easy way to analyze that previous data, how really can you plan and budget successfully? We've learned a few lessons from hospitals. One thing we've learned is that numbers don't just happen. It takes time and effort. As you know, a lot of hospitals are now involved in reporting to the IRS on their new Schedule H. It's been around for a couple of years. And we really have seen that some hospitals still experience problems coming up with the numbers for their community benefit programs, aside from maybe their charity care and Medicaid numbers. And so that's the biggest lesson we've learned, that numbers don't just happen. You do need to have that system in place to collect that information. So having a social accountability policy with standards and practices in place now will help you to prepare for maybe any future changes to tax laws or regulations. And once you've identified your social accountability programs and you've recorded some data about them, then the next logical step is to answer the question, well, are we making a difference? You're investing that time and money. Is it well spent? Measuring impacts and outcomes, evaluating the effectiveness of the programs helps you to understand when you really are successful, and maybe even when you need to revisit those program parameters, your goals and objectives. But once again, how are you going to evaluate those programs if you don't have any relevant data or information? We track our social accountability information to effectively tell our story. That's one of the big reasons why we want to be able to report social accountability and what we're doing for our communities. Really, it's important to understand where you are currently committed and what you are committed to. Collecting the data about that time spent planning, preparing, and doing your social accountability programs really does help to show your level of commitment to your community. So then the question becomes, how do you tell your story with current relevant information? How can you do that if you don't have that information? When asked about your social accountability programs, do you want to talk about maybe a food pantry donation you did 3 years ago? Or do you want to be able to talk about how your organization is reaching out and meeting the needs of real people with real problems today? Especially with the current economic conditions, there really are people in your community who need your services. Your community members need your expertise when they're trying to deal with a loved one, maybe just diagnosed with Alzheimer's. Or maybe you have community members who are facing tough decisions regarding how to care for aging parents. You have so much to offer. You have the understanding, and they're not going to know that you have that information unless you tell them. So you really need to think about that, telling your story and why it's so important. So you can tell your stories through your numerical statistics. Of course, there's numbers of social accountability. That's going to help you to quantify the dollars that you're investing back into your community through various programs, maybe donations you're making or sponsorships. The narratives are always going to help you to put a face on social accountability programs. And they're really going to help your community and your stakeholders to see the many ways you're impacting the lives of the people that you serve, residents and community members. And then, of course, narratives help you to move beyond just numbers and statistics. Social accountability information really can be used in so many different ways and for so many different reasons. But there's always 3 things you want to remember: collect, track, and report. If you do those 3 things, then you're successfully going to be able to show that you are accountable to your communities, that you do have much to offer, and that you are making a difference in the lives of your residents, your staff, and those community members. And next we have with us David Grant.
Good morning, at least good morning California time. I'm speaking from American Baptist Homes of the West. We are a multi-CCRC provider, 11 CCRCs in 4 states. We also have 33 affordable housing communities that also actively participate in our social accountability program. American Baptist Homes of the West, or ABHOW, has been in existence since 1949, but with regard to social accountability, it's been a very active program since 1998. The reason that we do this is for the same reasons that Trina discussed. We want to measure our commitment to our company's mission and the purposes for which we exist. Our mission is to enhance the independence, well-being, and security of older people. And our social accountability helps measure that internally, and as well as the way we provide services to the broader community. Jocelyn, I'm trying to advance the next slide, but I'm getting no help. Thank you. The goals of our program are to demonstrate that we are serving the broader community, as well as serving the needs of our residents, and to preserve, and I think this would be a primary goal, to preserve and protect our exempt status, which is so important to us. Trina mentioned Revenue Ruling 72-124, and that's the thing that social accountability for us is an adjunct to demonstrate that we are not only providing housing, health care, and security for our residents, but also providing or evidencing charity, which makes that whole tax-exempt status important and in existence. And as we demonstrate that, we build social capital. And this is so important to us to demonstrate to whatever our audiences might be that we are an organization that is charitable internally and externally. At the same time, I vision this as building a brick wall of insulation for ABHOW to protect against those who might seek to challenge or take away our exempt status. Some of you are in states, I believe there are about half of the states that give tax-exempt, real estate tax-exempt status to organizations like yours and organizations like ABHOW. And for us, that's millions of dollars we're talking about that we're trying to protect through being an exempt organization. What we do as we gather the data, Jocelyn, can you help me advance the next slide? Thank you. As we build this wall around us to protect us from those who would challenge our exempt status, we assign a number to each of those bricks. And when those bricks are in place, the wall is strong. A grand total is available, evidencing our commitment to community. In terms of how those bricks are determined, what we do is we've used the Catholic Health manual, I guess, as a lot of you do, a lot of us do, to figure out what's included or what's not included. For us, I have a summary of community services, a form that Jocelyn said would be available to you, that on which we track and gather all of that data. And then I also have available the guidelines for reporting charitable benefits that we put together to help our executive directors and administrators fill out those forms. In 2012, I should mention that we are going to go from our own internally developed SurveyMonkey that we've used to gather that data to Lion Software. Do you call it Sabisa? Is that the way it's described? I think, Trina. But anyway, we're going to try the Lion Software program because it looks very interesting to us and a very good way to track that data. But as each executive director and as each administrator fills out their forms, previously just manually, and then more recently through online through our SurveyMonkey, and then next year through the CIBISA, the Lion Software program, all of that data comes to me. I'm the general counsel here. I'm also the compliance officer. I'm also the risk manager and the HIPAA officer, but it just keeps me busy. But with regard to social accountability, we want to put out a report every year, and the importance of this report is not just to be a place where data is gathered, but it's a brag. It's an opportunity to show to our external audiences and our internal residents and staff all of the things that we do that demonstrate that we deserve to be and to be maintained as an exempt organization because we're charitable, and the tracking of the social accountability adds to that story, which we supplement through the narratives of or examples of people who are benefited or served, whether there might be a resident or maybe it's a community organization. But all of that information that I gather is put together in a report, and then it is added to through these stories and then distributed to our various audiences, because we want them to know within the communities that we serve, the residents that we serve, the team members, our staff that serve our residents, that we are a charitable organization, and the social accountability efforts of ABHOW are evidence of the fact that we are charitable, that we deserve to maintain our exempt status, and that we are serving our mission. There's another thing, or maybe to me one of the most important things that we do in terms of maintaining our social accountability efforts, and that is to put together a score sheet. And I'm having trouble again. Jocelyn, could you advance the next slide for me, please? This is, it's not an exact document. It's just an example of something that I use, or a version of something that I use. And the purpose of this is to demonstrate that ABHOW is not a drag on society, but in fact we give more than we get. And so what we try to do is, the tax-exempt status comes from the idea that providers who are given that status are doing the work of government. So if we're doing the work of government, or the government wishes it could do, how do we value that compared to the benefits that we receive by being exempt? Because those who might challenge say, well, you're just like the big for-profits, and why do you deserve the exempt status that you've got, and why do you deserve not to, or lower coupons on your debt, or whatever it might be? Well, we add all that up. What are the benefits that we receive by being an exempt organization? That's the left column. What are the real estate taxes that we don't pay? What are the personal property taxes in those states that we don't pay? That word care actually should be slid over to the right column. What are the federal income and state income taxes that we don't pay? What's the difference on the coupon on our tax-exempt bonds versus taxable bonds? And we add all that up. And for ABHOW, that's several millions of dollars a year that we benefit as a result of being an exempt organization. So if one were to challenge ABHOW and say, well, you don't deserve those benefits, our social accountability, the data we collect, the tracking that we do, the report that we publish, is to demonstrate that we not only serve the community and serve our residents, but also that we are providing charity which is equal to or in excess of the benefits that we receive. So the right column is how much benevolence do we provide, how much, this is just sort of our summary column, how much benevolence do we provide, how much uncompensated care, what's our pure charity, how much volunteer time do we provide. And by the way, I know there's always issues about volunteers and how is it included in one's summary of of charity provided. I think in 2010 the number was $21.36 an hour for each volunteer hour. Probably closer to $22 for 2011. We haven't done our summary yet for the year. And I don't count all volunteer hours. Everyone can do it their own way. I don't think there's an exact science, an exact answer to this. But the example that I use is if a staff member or a resident volunteers at a blood bank on their own, I don't count that hour. But if I have residents who are putting together a quilt, for example, and the quilt is then sold and the money received benefits the community or an ABHA community, then I count those hours. So that's just me or the way I look at things. But I come together this chart with all of the tax benefits we receive and all of the charity that we provide, with the goal that the community benefits provided exceed the taxes and the tax benefits that we receive as an exempt organization. And for the last several years, it's been true. Last year, the right column totaled about $17 million. The left column totaled about $9 million. And I think for bragging purposes, we can say we are doing all the things for which our social accountability program was aimed. We're doing all the things for which exempt status was granted. And here is proof of that. And that's one of the great benefits of our social accountability program. And sometimes we'll have a resident who will say, well, you're spending the equivalent of $17 million in providing community benefits. Why don't you just save that money and lower our rates? I think that's a good position, a good argument. But to me, the response that I think is better is that if we weren't doing this, and if we did lose our exempt status, it would have an immediate impact on your rates because real estate taxes would be imposed, income taxes would go up, the cost of our bonds would increase, and all of a sudden you'd be paying more in your monthly fees because we're not demonstrating our charity that we provide both to you as residents and to the broader community. And we wouldn't be fulfilling our mission, which is, of course, the purpose for which we exist. So that's how we look at things. In terms of the actual tracking, as I said, we use the Catholic Health program, but look at my form that I've put together for you that's available to you, and the guidelines, and you can use those, and you can do it as simply as a manual tracking through that form, or you can create your own SurveyMonkey. I think it cost us $500 to put that together, not very expensive. And this year we're going to spend a little bit more with Alliance Software, the Sabisa program, and see all of the good things that if you go online and see get a demonstration of what that software does, you might be very much impressed. Well, that's what I've got for now, and I'm going to turn this over to Kathy Policita from Fraser Meadows in Boulder, Colorado.
Hi, this is Kathy Policita. I'm trying to advance mine slides and they don't seem to be working. Oh, got it. I'm from Fraser Meadows Retirement Community in Boulder, Colorado, and I want to thank David Grant because David was one of the first people I reached out to when I wanted to start a community outreach program here at Fraser and social accountability. So I think he did a great job overview, and he's been a good mentor to me, and it was nice to be able to hear him talk today. I was hired about 3 years ago at Fraser. We are a single-site CCRC. We are a faith-based organization with Methodist roots. We have about 400 residents, which are divided by around 260 independent living residents, 35 assisted, and about 108 in our healthcare center. We've got 300 staff, 300 plus staff, and I was originally hired when I went through the interview process to be director of charitable giving. So fundraising was my primary role, and then they added community outreach because it was something that everyone has been talking more about. We wanted to start identifying what Fraser was doing. we have a committee of the board called the Charitable Giving and Community Outreach Committee, and we meet about 6 times a year, and we review the fundraising that we're doing, as well as what are we doing to serve the community. And I think it's important to have a committee that's based. We have residents that are on that committee, we have board members that are on that committee, and we also have community members. Jocelyn? If you can advance the slide. Okay. What we did initially is we spent the first 6 months identifying what are we currently doing. Because we are a 50, at the time I was hired, we were here about 48 years, and there was a lot that we were doing throughout our facility, but also we wanted to find out what we were doing in the community. And so when I did some research and went to the Leading Age website, I found this survey called 50 Plus Ideas for Senior Services Social Accountability Program. And what I did is I created a survey and sent that out. Well, first of all, we met with residents. I had resident meetings and then staff meetings. And we talked about the importance of social accountability, as we heard earlier today with David and Trina. And we talked about the importance of tracking and the importance of understanding what we're doing. So first, we used this survey to find out currently what are we doing. So what are some of the things that we were doing? We knew that at times we've done some health screenings for some of our residents. We were doing a lot related to the Alzheimer's Association. We were doing the memory walks. We were doing wellness programs that were open to the community. So we were identifying what we are doing, but also what are this survey helped us identify what other areas do we want to be involved in. So I would encourage you, if you go to the website on Leading Age, they do have the complete survey, and it would be a nice tool if you are new and just getting started. So after we did that, if you can move me forward, one of the things that we in the last year, we started to identify what are our residents doing, not only in our Fraser, how are they actively involved in Fraser, our community, but how are they actively involved in doing volunteer work in the community at large, in Boulder community. And so we just recently did a survey of mostly our independent and a few of our assisted living residents. And we found that we have over 14,000 hours of residents that are doing work throughout Boulder County as well as Fraser. And some people are just doing a few hours a week. One resident we were pretty impressed by does 10 hours a week, and she figured it was about 520 hours, and she works for about 10 different agencies. Another thing that we found through this survey was that a number of people identified where they give their resources, give their money, and that was not the intent of the survey, but it was really helpful for us to see where our residents feel that their interests are, and we're hoping to use the data from this survey to help us identify for the next fiscal year where we might want to put additional programs in place. With the survey, we're also planning to survey our staff, and then in April, which is National Volunteer Week, we plan to do an ad in the local paper about what is Fraser doing in the community and how are we serving them just the volunteer work that's being done. And we think that this tool will be very helpful in identifying it. So when I first started, like I said, 3 years ago, we spent the first 6 months just identifying what are we doing. We created, we have this is the sheet that we have up here was just a basic overview on different new programs that we could choose to, that people would identify that they were interested in bringing on. And then we have another tool, if you'd help me with the advancing, oops, sorry, Jocelyn. And that was just what we're trying to track on a regular basis, the different services and programs. Who's responsible? What is the type of programs describe the programs, the number of people that are being served, how much time that people are involved. So we just have this form that we have some staff putting together to keep track, and then all of that data is brought back to my department, Charitable Giving and Community Outreach, and we are in the middle of putting that material together. If you could advance to the next slide. What we've identified is that currently Fraser, not just the residents, but just all of the programs that we're doing, we have over 103 different community organizations that we are supporting either through volunteer efforts, through specific programs, like we do a community food drive about 2 or 3 times a year. We do the Alzheimer's Walk. We do Memories in the Making with the Alzheimer's Association. We do the Daffodil Days with the American Cancer Society. We've even created opportunities, and residents have encouraged us to do this when there have been national and international disasters. We've had the opportunity to raise money for those disasters. So when we had a Haiti relief effort, and we raised about, I think it was $5,000 or $6,000 for that. And then last year with the Japanese catastrophe, the tsunami, we were able to raise about $6,000 or $7,000 for that as well. So here are some of the things that we're tracking through. We're using the old-fashioned system. We're just using Excel. So we're actually tracking the name of the organization, the date of the different events. We're tracking the actual activity, what it is. If there's been a financial donation to that activity, we track our residents involved in that activity, are the board, staff, do we have external volunteers involved? We are very fortunate to have a waitlist group here at Fraser, and I hope many of you are as well. And we track our waitlist people involved in those activities, and then of course community members. We are tracking staff hours, but we've not tracked the financial cost of those hours, and we're also tracking the volunteer effort in the hours. But one of the things we hope to do is start in the future actually computing the types of staff that we're using, getting an average cost of their time, and then identifying the total cost and adding that to our tracking material as well. One of the things that I identified this past year, and I think David Grant also mentioned it, is the interest in using the CBISA software. And CBISA stands for Community Benefit Inventory for Social Accountability. It's through Lion Software. When I went to the conference, the Leading Age conference back in October, had the opportunity to hear a little bit more about it. And then I had the opportunity to have a conversation with them and learn more about the software. And I thought it was pretty reasonable. So our plan will be in the upcoming year is to order CBISA and then see. I think our reports will be a lot better because they'll have a lot more details. And they ask questions that we don't even think about. So we're very excited about using, starting with that software. But I think starting at just using an Excel document is a very easy thing. And then at the end of the year, what we've done is collected that data, put together just a general list of all the activities we're doing with some basic information about those activities, how they, who's being affected. And then as we create our annual report, which is something that's sent out not only to our residents and family members, but also to the community, we've chosen not to have a separate social accountability report because we are a single site facility, but we do have a substantial part of our annual report, and I think this year's annual report has a lot of good information. And what we've found is that people are sometimes surprised by some of the activities that we're involved in. And so we're very pleased to be able to share that information with the community to say that we are serving not only our residents, but also the community at large. If you can move forward. Something new that we've done just this past year. we have surveyed, looked at our management staff to identify what are they currently doing when it comes to volunteering in the community, and are they in board positions. Then we've identified what are the nonprofits. We've already done the survey of our residents, and we've done a survey, and we already know what we're currently doing with activities in the community. But we've identified which of those nonprofits would be served through involving some of our management staff. So we've identified key nonprofits that we would like to find ways that we can be involved in those organizations in leadership roles. And we're hoping this coming year to start tracking and plugging our management staff into some of those leadership roles. And we found already a couple of our leadership members have actually been able to, we've called nonprofits, we've said that we're interested in becoming more involved, and we have found ways that they can use our staff. And I think that's a way to show that we're very committed to serving the community at large. So again, if you can advance the next slide. I have a resource list. I'd say going to the leadingage.org website. I know that they recently updated it with some new resources. There's a local community here in Boulder, or here in Denver, Christian Living Communities, and they were very helpful as I was trying to develop our program. And then I mentioned the Lion software. This is a tracking software, and I definitely would encourage you to look into it. I initially thought it would be very expensive, but I think what it does for you, and it makes the information easy to track, I think it's worth the money. So again, thank you for this wonderful opportunity to share what we're doing at Fraser, what I learned as we were collecting, getting ready for this presentation. There's so much more that we need to do, but the important part is you need to get started. And I think as a single site, and I know what happens with us is I do fundraising, and I'm involved in this, and I also do marketing. The key is you just have to do this, on a regular basis and stay on top of it, because if you don't, it will be very hard to track all the information that you need to collect. So again, I wish you all well and hope that we can be a good resource for you. Thank you.
Great. Thank you so much, Kathy, Trina, and David. Once again, this is Jocelyn Martin from Holleran. I now have up on the screen links to all of our email addresses, as well as some additional links that Holleran uses, additional resources that Holleran uses and recommends. Kathy had certainly mentioned the Leading Age website. I have also put up here Corey Kallheim's contact information. Leading Age has also developed a social accountability listserv, and there has been some activity on it, but please feel free if you have a question or if there's a tool or something that you're using or something that you're doing in your community, use that as a network of your peers to ask questions of them, share best practices, so on and so forth. Excuse me. I have also listed Ashley Greenawalt from Holleran on this website. As I mentioned in the previous webinar, Holleran has developed a social accountability toolkit. We are planning its release by the end of the first quarter of this year. And it's just a multi-phase approach for you to enter where you are within, at this point within social accountability. So if you have your board involved, you have a budget, you can skip that chapter, but you might be interested in taking a hard look at the tracking section, the communicating section, so on and so forth. So if you would like further information on that, if you'd like to be included in our marketing information concerning the Social Accountability Toolkit, feel free to shoot Ashley Greenawalt an email and just let her know, and she will add you to the list. Now we would like to open up the webinar to any questions that you may have. As I mentioned, there's a little box on the lower right-hand corner that says question. If you'd like to type in a question there, I will be reviewing them and asking the panelists to answer the questions. So I'm just going to take a moment now. David and Trina, I am now bringing your microphones back on so everyone is live, and then we're going to see if the panelists can answer some of your questions. So the first question is, we have a benevolent fund in our facility in which the main sources of contributions are current residents and to some extent employees. Any comments on how other communities balance fundraising for their own facility versus publicizing other fund drives that may be worthy, Any comments on how other communities balance fundraising for their own facility versus publicizing other fund drives that may be worthy causes but cannibalize contributions from the facility's own fundraising efforts? So if any of you have a comment for that, I would appreciate it.
Because I do fundraising, I'm not sure exactly the whole thing. I would encourage that. I know that's a concern. We find that our board is very concerned that we don't do a lot of fundraising externally unless there's a special project that we're going to be involved in. And when I heard that question, I would say we do solicit family members, and I didn't hear that. And I think that they are reasonable people to solicit, especially for the benevolence fund. And then what we do is we just had a year-end campaign, and we did identify a program that would be open to the public, and that we have received gifts from people outside of Fraser because I think that program has more of an interest in people that are not just resident-based.
Thank you, Kathy. Do David or Trina, do you have anything to add to that?
We don't count those fundraising dollars as part of our social accountability program. I think it's a sort of an interesting idea. I know that I've looked at that before using the Catholic Healthcare or Catholic Health Association Community Benefit Reporting document, and it's not there, and therefore I didn't use it, but that doesn't mean that it doesn't provide some social benefit. I'd be interested in that, and I also, from my own perspective, I like to add anything I possibly can that I can justify, for the reasons that I said in my presentation, to brag, to demonstrate community benefit, to preserve exempt status, and so forth. But right now, the answer is no. We don't count those dollars as part of our social accountability program.
And this is Trina. I would also add that if if it's not a cost to your organization, then you probably wouldn't count it as a cost of social accountability. But when you're telling your story about what it is that you do, I think it's always extremely important to include the way that your own residents also give. So while the amount of the money that's raised may not go towards a dollar amount for social accountability, just the fact that your residents are very active and care about their own broader community that they live in is a very important story that you want to be able to tell.
Yeah, and I would agree. I don't count the money raised for social accountability in social accountability, but it's there.
Okay, just a couple quick questions that I can answer here now. The PowerPoint and the recording of this webinar will be sent out. It will be emailed to everyone that has registered for this webinar within the next week or so. It will also be listed on Leading Age's website, Holleran's website, and it will be posted to the Leading Age Social Accountability listserv. The next session that we're having focuses upon communication, so getting your message out, telling your story, and that will be February 20th. Okay, now the next question for the panelists. Please define benevolence versus charity versus uncompensated benefits.
That sounds like me. And the uncompensated is the difference between the cost of providing care and the Medicaid payment received. We haven't tracked that for Medicare, but for Medicaid, we provide the same level of service to our Medicaid residents as we do to our private pay residents. So if our Medicaid rate is $160 a day, then that's how much we receive. If the cost of providing the care is $180 a day, we would count those $20 as part of uncompensated care. In terms of benevolence, that's what for those who have outlived their resources or are short on funds to be able to make their monthly payments, our social accountability program provides that difference for them. So that's the benevolence that we provide, and the charity is just other good, worthy efforts that deserve our attention and dollars that could be within our community or within the the provider community or in the broader community in which we exist and live.
Okay, thank you, David. And then someone else writes, while these examples are interesting, I'm confused why volunteer time and donations are being tracked by these groups since they are not allowable by the IRS. These may be interesting to statistics, but they have no direct costs associated with these facilities. I'm sure these stats would pass. I'm not sure these stats would pass the last test if reported in paper.
David, you're the attorney.
Yeah, well, I'm not sure about the test that I'm interested in is just summarizing the amount of charity community benefits provided for our social accountability program. This is not an IRS test. This is not a state tax test. This is just what we do to demonstrate that we are charitable and we're providing community benefits. So I don't need to test it other than within our own personal or own ABHA definitions and count it if it fits that definition towards the total sum of all the dollars that make up our social accountability program.
Okay. Kathy, do you have anything you want to add to that?
I have used David as a guideline on some of those issues.
Oh, don't blame me, Kathy.
Goes right back to David. There you go, David.
As a guideline.
Okay. The next question is, could someone speak on how the community organizations are chosen to benefit from the facility's outreach efforts? Our current solicitation policy would prohibit us from advertising or raising funds for specific organizations such as Alzheimer's Association Walk, etc. Thank you.
Well, I'll just say what we do at ABHOW, and I'm sure, and I think Kathy's probably got better answers, but we ask all of our communities. I mentioned I've got 11 CCRCs and 33 affordable housing communities. What organization or what concern within the broader community in which you exist deserves our attention through the giving of dollars or grants or whatever it might be. And not all of those, of course, can be served or recognized. So, but it's for us, it's local. What does each of our communities think that is important in the broader community that our social accountability program might serve? I really like the idea, though we haven't done it, of having one program that all of our communities want to support within their communities, such as a senior helpline, or where people can learn how to set up something for transportation. All of our communities serving the same kind of purpose all across those 44 communities in which ABHOW exists, but we haven't done that yet, but I like that idea. Kathy, what do you do?
You know, before I worked here, I worked in another CCRC in Ohio, and I didn't do any fundraising for outside groups, so this was somewhat new to me. But we have identified, and through committees, identified what are those organizations that the community, our group of residents and our staff would like to support. So we've used, you know, we have sanctioned those projects that the community supports, and have done many fundraisers for them, and we've had a strong interest by our residents to do things for others, not just for themselves. So, like I said earlier, the Alzheimer's Association, the American Cancer Society, the Community Food Share have been very strongly. We have a strong support by, and not requirements, but we are doing fundraising for these other organizations, which is somewhat new. I've not done before, but I do think it shows that we're there to serve others.
Okay, thank you. And then certainly, and Trina, I know this is something you could speak to as well, community needs assessments that hospitals have been mandated to perform will also help to identify the needs of the greater community as well.
Exactly. While you're thinking about, you know, how to find out about the different needs within your communities, remember that you do have sort of built-in partnerships with the hospitals that are also in your communities, the not-for-profit hospitals that will be participating in community health needs assessments over the next couple of years, and then along with public health departments also that may be seeking voluntary recertification or certification, they may also be involved in doing some kinds of health needs assessments. So they're always a great partner for the senior living communities to really look at and say, are there needs that our community has that have been identified by these groups that we may be uniquely qualified to address.
Great, thank you.
And I was just going to, oh, sorry.
No, go ahead, Kathy.
I was going to say we came together with 5 different organizations, the county senior services, the hospice care, and the courts, and we put together a new program that had not been in existence in our area, but it had been in Denver, called Senior Law Day. And so we came together with a variety of organizations and created a new program for the community. It was a one-day seminar where people can learn about anything that was related to senior issues, and we were a major sponsor and major organizer of that event.
Great, thank you. And Trina, this next question I believe is something that you can answer. What is the platform for the software program being developed to track social accountability? Will it be web-based?
The Civisa software is a web-hosted application, so you do just have to have access to the internet to be able to securely access your Civisa program. And we can, of course, give you a demonstration of that software, as Kathy was talking about earlier. We'd be happy to show you, show anybody that calls our office a demonstration of the software so you can get an idea of all the different ways that you can really collect and track and report the social accountability information.
Great, thank you. Okay, next question is, we have a benevolence fund for our facility in which the main sources of contributions are current residents and to some extent employees. Any comments on how other communities balance fundraising in their own facility versus publicizing other fund drives that may be worthy causes but cannibalize contributions from the facility's own fundraising efforts?
Didn't we just answer that?
Oh, did you? I'm sorry. Okay.
That was the first question.
We track what staff is doing, but from what I heard, we should be tracking what residents, board members, and wait list people are doing too. Please comment. So are you looking at wait lists, board members, and residents as well?
Well, let me just comment on part of that. One of the things that all of us at ABHOW in management are required to do as part of our job descriptions is to be, the way we put it at least, is to be thought leaders. And the ways we do that is to participate as we can through programs through our state and national associations. And many of us put in a lot of hours towards those goals, which we think are good for not only ABHOW but good for the associations that we serve. So we encourage that of staff, we encourage that of our directors, and we count that time.
We don't include wait lists. We have not chosen to survey them because they're not official residents, but that's an interesting question.
Okay.
Yeah, we don't either, Kathy.
David gave an example of which volunteer hours he counts and doesn't. The distinction between quilting and donating blood was not clear to me. Please explain. Please expand.
Well, maybe it wasn't a very good example, but what I was saying was that, take the quilting example. The volunteer hours that are used to create that quilt are intended to benefit the community, because the quilt, once produced, will be sold and the dollars will have a direct benefit to the community. If a person chooses to give blood, that's something that they do on their own because of their own, the importance that they see from a social perspective, but it doesn't have any direct benefit to the community. So I count the quilting hours, I don't count the blood donation.
Okay. Do either Oh, go ahead.
I was just going to say, hey, David, if you had a blood drive on your campus, would you be counting the people involved?
I don't know. That's a good one.
Yeah.
Yeah.
It's
Again,
something to consider. Yeah.
I have to. The dividing line for me is does the community benefit from the volunteer hour or the service provided? Is there something that benefits the community that we are doing or encouraging? And I suppose as I think about that, the giving of blood maybe I'm wrong about that. Maybe I ought to be including that.
It's giving
Trina,
life.
what do you do? Yeah, well, it is, but there's the blood is then available in the hospitals for those who need a transfusion. I don't know. This is good for me. My eyes have been opened to another possibility here, but that's just an example. But Trina, what do you think? Would that be included?
Well, most of the time when we're talking about trying to actually capture the cost of social accountability, we are looking at those kinds of programs that are a cost to the organization. So is our staff involved? Did we have any supplies that were going towards a certain program? Then, of course, that would be an actual cost to the organization, and we would count that as social accountability. But some of these things, like you were talking about, that, you know, maybe your staff or your residents are doing on their own time and really isn't a cost to the organization, then that may be part of the story that you want to tell, but it may not be part of the quantifiable dollars that you're looking at. So it really just kind of depends on your definition and what it is you're trying to do with those dollars spent for social accountability.
Oh, good answer. I wish I had said that myself.
I agree, Gina.
All right. Well, it is now 2 minutes after 2 o'clock, so I just want to thank everyone for the time to participate in this webinar, and certainly thank our panelists, our speakers for this webinar today. There are quite a few other questions that were asked, and we will respond to these questions from Holleran. We'll respond directly to the additional questions that were asked. David, there's quite a few for you, so you will be very busy after this webinar. So once again, thank you all so much, and please feel free to reach out to any of us on this webinar if you have additional questions. So thank you very much, and have a great day.
Thank you.
Thank you.